Hello, hello, hello. Welcome again into Strategies for Living here on 1017 FM and 710 Keel. I'm marriage and family therapist David McMillan. What are you smiling about down there?
It's Friday. Woo-hoo!
Yeah, PLPC Carla McCormick.
TGIF.
Yeah, just smiling like a Chessy cat, huh?
I'm always.
Yeah.
Just call me Sparkles.
And I do, and we're also happy that our ace producer is sparkling back with us today. You recovered yet from vacay?
It's a slow process, but I think I'm slowly shaking the rust off.
Rapid Ruben Wright, thank you for keeping us flying high, low, and in between.
Oh, I do my best.
Yes, you do. Have you ever heard voices, Carla?
Uh-oh.
Not in 18 years.
Well, I'm really not setting you up. We've got a special treat this evening. And I think it's especially going to be it's going to be a special treat for all of us, but especially for you, because we've got Mr. Greg Greer in the house, and he's got something very special to share with us called Voices of Recovery. Now, you may not have heard of that before.
I have not.
But you're going to hear about it this evening here on Strategies for Living.
You know, I'm all about anything recovery, so.
I know, and I think you will very much be all about this. Folks, thank you for tuning in to Strategies for Living. We are presented by CADA, the Council on Alcoholism and Drug Abuse of Northwest Louisiana. Been helping individuals and families for 60 years, and you don't have to leave town to get treatment. Just check out CADA. We're also brought to you by Jerry Anderson State Farm Insurance, by Learning RX, by Highland Place Rehab and Nursing Center, by Resilient House, and by Jacob's Well, Inspirational Books and Gifts.
Hey, David, is Carla your intern? I was just hoping maybe she might be an intern or something.
Is Bill Clinton here?
Where's that voice coming from?
I'm afraid.
Yes, be very, very afraid. Greg Greer's in the house. Buckle your seatbelt. You don't know what you're in for. You really don't.
I might be. I really am afraid.
There's a calm before the storm. I know it's been coming.
And welcome back. Welcome back into 1017 FM and 710 Keel. Welcome back into Strategies for Living. I'm marriage and family therapist David McMillan, PLPC Carla McCormick. Let's welcome to the program now our life strategist, Gregory Greer. He is a full-time counselor at Palmetto Addiction Recovery Center in Rayville, Louisiana. It's a 100-bed residential facility recognized nationally for its work with alcoholism and addiction. Over 20 years, Gregory facilitates group psychotherapy and individual therapy and family therapy for alcoholism and addiction. He's developed and presents lectures that are interactive with clients, geared for motivating participation in group therapy, exploring each other's experiences in life and the feelings that coincide. So please welcome Mr. Gregory Greer to Strategies for Living. Mr. Greer, welcome.
Thank you very much.
You
Or should I do Elvis?
well,
thank you very much. I brought a peanut butter and niner sandwich.
I love it. Oh, God.
You're cringing over
I'm
there.
not cringing. I'm
Dicey?
smiling. I'm waiting
No.
for David to say something.
Voices of Recovery. How'd you come up with this, Greg?
Well, I have a history, and
Yeah, you do.
yes. Well, which history are we talking about? I worked in radio for a number of years, and I did a number of voices for the morning show.
Yeah.
And that was all for comedy. They didn't want me talking at all. They wouldn't let me use my own voice, and I was very frustrated.
You can only be,
Oh, yeah,
be
if
Bill
you're-
or Elvis or,
if you're
or
going to
Cosby
speak, and
or whatever.
I
Yeah.
had to have something. So I did that for a number of years, and then I started doing stand-up comedy. And I moved out to California for a while, and I did some stand-up out there, and that was my shtick,
Yeah.
if you would.
Yeah.
And so a friend of mine who is a national interventionist, he suggested, because my workshops, I've incorporated my background of comedy. And thank God I didn't, obviously wasn't very funny. So I'm in the field of addiction now. So anyway, so with all the humor that I like to interject to get people's attention, that he said, why don't you call it Voices of Recovery?
Whoa.
Because of all the impressions that I use.
Yeah.
And I said, well, that at first I thought it was kind of cheesy, honestly.
Yeah.
And from an existential perspective, I said, well, what is my inner voice? And spiritually, what voices, am I paying enough attention to others, and what could that be? What can that mean? What purposes do I have in life? And so Voices of Recovery, find your voice. And that was the platform. That was a platform that I had.
Wow.
And from it, and really I had no idea what this was going to be. Voices of Recovery, it turned into a small private practice.
Right.
Palmetto allows me to develop my workshops and presentations with our patients.
Right.
And I get to tweak those that's probably way inappropriate word for art.
drug
for art.
addicts, tweaker.
Yeah, sorry. So anyway, so I get to keep revising these, and I go to treatment centers in Louisiana and outside the state, thankfully, and I get to continue these in other conferences as well.
Yeah. Now you're a clinical member. You're a certified group psychotherapist. I know you and I have spoken at length of how much you love group therapy.
That is my passion.
Yeah.
And American Group Psychotherapy Association, I've been a member with them since 2008, if my memory serves.
Actually, a faculty member presenting there too.
I have
Yeah.
presented in Boston and New York, and what a fascinating experience to work with so many people. In fact, now having worked in the entertainment industry, and I'm going to say the B-rated entertainment industry, I never really made it anywhere big, but
Your own strategies, son.
oh, I'm big now. I'm feeling it. I'm big, people. So but with and I'll share some stories. To show just how. Look, I'm a recovering alcoholic, so I'm gonna go ahead and throw that out there since I'm in the field of
Oh,
addiction.
well, we want to talk about that. Yeah.
And we'll cross that bridge. It was interesting when I was in LA to meet with so many celebrities at some point in time that when I got into the field of being a clinician, the American AGPA had so many large, I call them celebrities. Albert Ellis, who developed REBT, rational.
yeah.
Well, don't catastrophize. Well, I was an early grad student in 2008 and 2009. I went to my first conference in New York, and I wanted so badly to share my new knowledge, my newfound knowledge from grad school, because I don't speak unless I have references. And of course, the references was in speaking about Albert Ellis and how healthy boundaries, professional boundaries. And for those of us who know Albert Ellis, he
Crotchety old
dated.
guy.
Yeah, well, he dated several of his patients.
Yeah.
So I'm sitting up there, and I was like, how many women did he marry? That was his patients. And I'm in a very prominent gathering of people, and my young pride self was talking, and somebody came up to me afterwards because I was like, well, he slept with some of them, however, and they said, he may have passed, but his wife is in this room with us today. I felt about a centimeter high.
Actually, after his passing, I interviewed
You interviewed him after
no,
his passing?
I interviewed his wife, his last wife after his passing.
Now, is that the punch to get me for saying that again? Throw extra guilt in my way?
Yeah, well, Carla
That's
and
just
I
twice now.
Yeah, we're all about guilt here, Greg. You should know that. You should have known that coming in.
Wait till he pulls out the shame.
I feel that. Oh, I'm a bad person. I'm so bad.
Well, it's interesting because we're still, a young enough field where it's so neat to be able to meet the masters and rub elbows with people like now departed Albert Ellis and now departed Bill Glasser. Both of them I've met. I even met Bill Masters
Of course you have.
before the end of his life. So
He's actually really met and interviewed almost everybody that is anybody in this industry and field.
I don't know about that, but
It's true.
it's been fun. Yeah.
Well, my several mentors that we bring on by engaging this field, Jeffrey Roth, and I left the book out in my car. He's somebody that I've been working with in Chicago, and he's doing addictions in group psychotherapy. And he has an amazing book that in most LPC or counseling programs, it's used often in the curriculum to help students take a look at the group process and group dynamics.
What is it about group? And Carla, you and I have spent more than a little bit of time. What is it about group that is so powerful in terms of being a change agent, and at the same time, before you're in it, so intimidating? I mean, because you think about, okay, well, I want you to go to this group. Maybe it's an AA group, and I got to go into that. I got to go into all those people, So it's paradoxical to me, that it is so powerful because it's a powerful, powerful means of recovery, and yet, many of us are afraid of it until we experience it. What's that all about?
I'm curious of Carla's.
Me?
Yeah.
I think, well, from my standpoint, I love to watch the process. I love to watch an angry, closed off person begin to open up, begin to trust, begin to learn to articulate their thoughts and their feelings. And so, for me, I view that as a privilege. I think the power is actually in that process. It's the process of unfolding, because they do come in angry and closed off, and I think when it's kind of the me too. If they can hear their story in someone else, if they can relate at some level to someone else, and they don't feel so alone and so isolated, and so because what's the thing, if they like me, but if they knew who I really was. Yeah. So if they're in a group of other people who are kind of dealing with the same thing, then I'm not so isolated and I'm not so alone.
Yeah.
And the healing comes through the group. Also, if you're acting up or telling a fib or not being honest with your
emotion, the group will call you on it pretty quick.
Yeah, the counselor can't always say BS, but the group can.
Yeah. Yeah.
What do you think?
Well, I wanted to hear your perspective, so I don't get clinically cuckoo for Cocoa Puffs. I love so much. It's the defense mechanisms that we come in there with. We're totally fearful of being intimate, and so what are those? What are those boundaries or barriers? Excuse me. What are the barriers to intimacy? And that can open the door. And I went through group. Well, I went through treatment like 3 times. I'm a very hard egg to crack, I guess. And again, wrong terminology. So should I hold back?
No,
back.
no,
I'm looking
no.
at ours. So I just recalled the terrifying intimidation that I experienced in that group process, and I could not relate to anyone, nobody, and it took a really long time for me to be able to open up. And those defense mechanisms had been created for such a long time, but the ability to watch the group identify each other's defense mechanisms so we can lower them down, so we can learn how to be vulnerable with each other, and then we can be open. And like you said, the magic word is trust. I have trust issues, so I'm really not going to do this at all.
Yeah.
See, I was a total opposite in group. You know, when I went to treatment and I was in group, I was one of those annoying people that was going to win group. You know, I was going to be the best. I was going to be the best client that this counselor ever had. I was going to be the most articulate. I was going to win group, and I didn't. I was humbled.
Group has a way of doing that too, don't
Yeah, that group does have a very good way of doing that.
Well, the desire to be the perfectionist wannabe and to look good for our image because we're so insecure,
Right.
that the reason what motivates us to do whatever it is we're going to do in group and allow the group to actually engage us so that we can go through that process. And that's what's so terrifying. Now, I didn't know that, having done stand-up comedy. I worked in theater, I worked in radio, and suddenly I'm in a group and they asked me, "Why can't you talk, Greg? You have spoken." I said, "Well, I was usually drunk." so I really don't know all this intimacy stuff, and that word is too foreign.
See, I was an egomaniac with an insecurity complex. That was me.
Yeah.
I'm an egomaniac with an insecurity complex. I love it. Voices of Recovery, Mr. Greg Greer, our life strategist today. You want to find Greg online, voicesofrecovery.org. We'll come back and talk more. Got a lot more to talk about with life strategist Gregory Greer today here on Strategies. Stay right where you are. Welcome back. Welcome back into 101.7 FM and 710 KEEL. Welcome back into Strategies for Living. Marriage and family therapist David McMillan, PLPC, Carla McCormick, Gregory Greer.
Welcome back. We're back. We're back here in the studio.
Hello, Arnold. You're where'd you come from?
I don't care. I came here from down the hallway.
Yeah.
From down the hallway. I'm here. I'm here now.
This is all about finding your voice, Carla. Did you know this was about finding your voice?
I don't think he knows who his voice is.
You may
Oh,
not.
I heard that all the time growing up. Thank you.
Flashback, PTSD.
Online, voicesofrecovery.org, and keynote speaker, comedic performances. He'll even do radio events.
Voila.
There you go. So you want to talk to Greg? The way to do that is voicesofrecovery.org. So it is ultimately finding your voice, right?
Yes.
Yeah.
And I think you said it. What voices do you have? You know, we create our personality, if we want to go through the old Erik Erikson's psychosocial milestones of human development. And through those events in life, who do we become? How do we become who we are? How do we become who we are? This presentation that I created some years ago, it was interesting to see how many people would not participate with many of the lectures that patients endure.
Right.
I'm using
Right.
the word endure, suffer through when they go through treatment. And so from an entertainment perspective, it's like, gee whiz, how about engaging? How about engaging? As a member of AGPA, it is all about interaction. And so I've become a big fan of psychodrama as of late. And so how to engage even further. So what I started doing was as a group, I would introduce, I get the clients all in one big room, and I let them know my passion as a group, and after I introduce myself, et cetera, and I let them know I'm an alcoholic. I tell them my past.
Right.
We're going to have a group now. You guys are a group, all 80 or however many people are in the room, and I'm going to introduce some new group members. And what how many people have been in? What kind of questions do you ask new group members? How do you welcome them to the group? What kind of exploratory questions do you ask? Now that's a clinical term, but even those in group are going to be able to ask. Well, what made you come to treatment?
Yeah. What are you doing here?
Yeah, exactly.
Yeah.
And so, even with you guys, so I say, okay, so I'm still going to be Greg, counselor guy over here, and I'm going to let these guys introduce themselves, and then you answer. You guys ask the questions, and then we'll go from there. Then everybody understands. And so I was like, okay, so I'll let you guys introduce yourselves, and then, hi, how you doing? My name's Bill, and I'm here for a 3-day evaluation. That's it, pretty much it. My wife thought maybe I may need some counseling of some type, and I said, well, I just want you to know I did not inhale. I did not, and I did not have sexual relations with that woman or that man. There's a lot of rumors going on out there. So all humor aside, I'm completely open-minded to this process. I said, sure, if you want to let some professionals do an evaluation, an assessment, I'm fine with that. So I'm here to allow the professionals to try to, determine whatever criteria they feel that I may meet. I'm more than happy. I'm more than willing to go through any approach or intervention that they feel necessary to have a positive outcome. Again, if I meet some criteria. So I'm here to facilitate with that process. and so that's what. God bless all of y'all for being here. I think y'all are wonderful going through what you're going through. And if I can help you in any way, please ask me, because that's exactly what I'm here for. And I did not have sexual relations with that woman.
Well, that's right. That's right, Bill. My name was Bill too. And I didn't have sexual relations with that woman either. I just, wanted a little bit of that Jell-O pudding, if you know what I mean. Yeah, that's right. It's okay. Look, seriously, I just want you to know I do the cocaine. And I know I do the cocaine. I have a problem with the cocaine. So I'm here to get off of the cocaine. Because when I do the cocaine, I'll sit in my room for hours watching the pornography with the cocaine. You know, makes me like the ladies. You know, I like the ladies, so I go out there and that's what I do. So I'm here. I can't do that no more. No, I can't do it. So here I am. I'm here to. Oh, hey, what's brown and sits in the woods? When is poo? That's okay. All right, so we're gonna get sober, right? That's what I'm talking about. So that's what I'm here for. Okay, thank you, Bill. Nice to meet you too.
Hi, my name's Jack. Look, the only reason I'm here is because that wench of a woman has had an intervention on me, and she seems to think that I drink too much. I don't know about you people, and honestly, I don't care. But I'm telling you one thing. I have enough money in my bank account, and there's no way that I'm going to let her have half of what I had. So 28 days, 30, whatever it is you people got to do, let's do that. I'm not here to be your friend. I'm not here to take warm showers with you. Let's just do this 28-day thing. And for any of you people who drink Woodford Reserve, well, you're a friend of mine. Nice to meet you. Piss off. Oh, that's great. Oh, that's great. That guy is he's pretty ticked off, is he? Oh, sorry about that. Yeah, look, so my name is Scotty. Yeah, I got my 8th DI. And so, like, you know, I can come here for like 28 days. Oh, wait, we're in Louisiana, right? Oh, that's DWI. Gotcha, not DI. All right, so I got a lot of these things. And so, you know, here I am. I got it. 28 days. And oh, wait, this is AA, right? Yeah, oh, go AA. Yeah, go AA. Thank you. All right, there you go. I did have an epiphany, though. I did last night. I just figured it out. So I figured out if you don't drink on drive, you won't get a DI. Holy God, that's great, right? So I figured it out, you know. So you don't need a counselor. Come talk to me, and I got it figured out. So no more. I told the judge, no, you know, no more drinking and driving. So drink all you like, just don't drive, for crying out loud, right? So there you go. I got that going on for me. So yeah, that's the ticket. I think. Yeah, that's it. Great, nice to meet you. Oh. Hey, look, I work on the other side of town, so if you're wanting to have a drink, just bring your chip with you, and first drink's on your white little silver chip there. Okay. 2 cockroaches. Okay, so my name is Tony, and I got a little bit of an ego problem. And I'm telling you that I'm pretty messed up. That's right. I know I'm messed up because I even want to have sex with my own sister. And I know that that's pretty messed up. So that's what I'm here for. I'm here to get off of the AO. I'm going to get clean. Do you know how to get clean? You talk to me. My name's Tony. I got a power. And I got a power. I got a money. So that's all I'm telling you. You come talk to me. We're going to take care of it, okay? All right. Nice to meet you. Okay. All right. So I walk over there. Hi. These are your new group members. These are your new group members. Now, if you've been a sponsor before, if you've been in group, you know, what kind of questions would you ask these guys?
Oh, man.
I'm curious. Well, now that I got 2 people in here, I mean, what kind of questions would you ask?
Oh, geez.
And then, but you got to say, you know, hi, you know, my name's David, I'm Carla, and then you would have to address which one, because otherwise it gets really confusing for me.
Well, Bill.
Yes, that's me. Hi, how you doing?
You seem to just think you needed an evaluation. You're on the way out. You don't seem to really want to be here.
I'm sorry. Well, I'm here of my free will to have an evaluation.
Yeah.
I think entirely opposite. No, I'm very much here to participate and engage whatever this process is.
Yeah. Well, you're not perceiving that you have much of a problem. It's.
Well, I leave that to professionals. Now, as soon as you know they determine, you know, if I meet any criteria, then again, I said I'm very willing and open-minded to participate, whatever that process may be.
Yeah. Other Bill, you're a little messed up.
No, I can tell you right now, I'm super messed up. You put a Mr. Super and together, we're talking messed up. I know. Yes, sir. But thank you. I'm so glad you're here. Thank you so much.
Help me out here, Carla.
I'm just so enamored by the voices.
Well, I was gonna say, Carla, during break, you said that you were the star of group
said I was
some time
the
ago. Maybe this would be your chance to shine,
The star of a group.
and you can
So-
challenge these guys. They
I can challenge Tony.
absolutely.
Oh, you're going for Tony. I knew you'd go for Tony.
Tony, you don't seem appropriate to this group. Are you sure you're in the right place?
I don't know. I got on the phone. I said, hey, I need some help. You gonna help me? You help me? I'll be there. 5 minutes. Here I am. Hoo-ah.
Tony, you ever heard the saying that you have to be willing and ready to help yourself?
Do I not look willing to you?
No, you don't.
I think you got a problem. I think you got a look in your eye. I'm telling you, I am here for help.
What
So
kind
there.
of what kind of help are you here for, Tony?
To stop doing the Ayo. Okay?
How are you going to do that, Tony?
I don't know. You tell me. You the boss. You tell me. That's what I'm here for.
We do have clients just like that.
So, but there are people that are inappropriate for treatment. So, if you felt that, how would you determine that?
Well, it would take more than this conversation.
Can we get any of these guys to? The question is, can we get any of these guys to step one? Right?
And you know what? Here's the thing about group, and you can sometimes the people that you think that will never get it, get it, and they buy in, and the ones that you think, oh, they're going to be okay, it's just all an act. So I have not been super great at guessing who's going to make it and who's not, and who's going to get it and who's not. Have you?
Absolutely not. Not
I think it's
not at all.
dangerous to try to guess.
I think I gave that up years ago.
Yeah.
Based on what behavior, the patterns of the past. If they continue to do it, then I can say maybe they may not. But over a period of time, I've never said you're not going to make it. I can say if you continue this behavior,
Right.
you're not going to make it. The big question with these personalities that you're engaged with is they're not who you think they are.
We all think we know right now. We all think we know exactly who they are, don't we?
Absolutely.
Yeah.
Because you're engaging the personalities that as you believe they are. And I say that because how many times have you walked up to somebody and just based on judgment of visual clothing, how they behave, how they communicate, and so I communicate in a manner in which they come with me. That's just any Joe on the street. And so just based on the personalities and how they present, we engage those personalities as to who we think they are.
Right.
So when we come back from this break, Bill, can you take us into break?
Oh, absolutely.
Okay, so when we come back from this break, we are going to find out who they really are. Go, Bill.
Oh, and we'll be back in just a minute.
You got to do a little more, Bill.
Well, I dropped my line. What's the line?
Greg Greer,
Oh, hey, we'll be back with Greg Greer.
right here on Strategies.
Here on Strategies of Life.
Yeah, for living, Bill.
living.
For living, Bill.
Well, I'm retired.
Okay, we'll be back.
I feel tears welling up, cold and deep inside, like my heart sprung a big break. And the stab of loneliness.
You gotta love Ruben. 1017 FM, 710 Keel. Welcome back into Strategies for Living. Marriage and family therapist David McMillan, PLPC Carla McCormick, and social worker Gregory Greer, the Voices of Recovery.
Yes.
You can find him at www.voicesofrecovery.org. Now, okay, you say that we've all heard the voices, and we think we know who we're engaging, but you say we don't.
Absolutely. Now, I usually tell my story a little bit before I share or I go into, the scripted routine. And afterwards, I said, well, so these people are not who you thought. These people are all me. And I share my background. For example, that when I was 8 years old, there were babysitters that would teach me how to have sex. And I actually attempted to have intercourse with my 5 or 6 year old sister at the time, and I cannot tell you how much that messed up my head for a while. And so that occurred. And as far as Scotty goes, I attended bar for a number of years, and so I lived that life.
Yeah.
I've been hospitalized 8 times to my recollection, but the 8 DUIs match my admissions numbers.
Yeah.
The Jack character, I talk about him a great. My first wife was full-bred Italian. Nothing against Italians. I mean, I obviously liked her very much. But
You gotta love Italians.
oh, it was very passionate. But it was so volatile, so amazingly volatile, and so a lot of the discussions are what I brought to the table had to do with my first marriage. The Bill character, Bill number 2, I did stand up for a number of years, and so I used a lot of humor, a lot of voices to back. And as far as the cocaine goes, I found out at one point in time, if I could do that, I could drink a whole lot more. And I really liked to drink back in the day.
Yeah.
My alcohol blood level was always near a 0.4. And every time I was hospitalized, my blood pressure was 205 over 165. And that was very common. That was very normal. To me, I was like, well, this will pass. Don't worry about it. Just give me a beer and we'll be fine. But that was very common to me. It was minimized. And so that was part of my story. And not to get too much of it on the air, but the sexual activity that occurs with cocaine or stimulants, methamphetamines, there is a heavy sexual activity that goes with it.
Right.
And I engaged with it at great length when I was in Los Angeles, so much that, wow, you want to talk about getting STD tested on a regular basis for 10 years, because I had no idea what was going to occur. And my wife's listening, so hey, baby. She knows I've told her all about this, because this whole process is about learning how to have self-love. Connie Miller, a friend of mine who does soul drama, that I'm hoping that y'all can meet one day.
Yeah, we want to have her own.
Her definition of codependence is the absence of self-love. The absence of self-love. And so the whole process of doing group, to me, was, and with it, AA as a whole, is we love you until you love yourself. And so over a period of time, I was able to love me. And so I share all of this that I've told y'all or anyone else because I'm okay with who I am. Now, other people I may share this with, they go, "Oh, you did that? Ooh."
Right.
Because I didn't have sex with a goat, but, I came pretty close. But the thing is, I'm okay with where I've been and what I've done. You may not, and that's okay, too. That is okay, because I'm not affected by how you perceive me.
Right.
And that's an important factor of what self-love comes. And I think any self-help group, any solid, the power of group, because we're here to help you. We're here to help each other together. Our common welfare comes first. That's tradition 1 of AA. And so that particular character, Bill, that's my story there. Now, as far as the first Bill goes, the third time that I went into residential treatment, it was after the second. I was PEC'd when I lived in Baton Rouge, and I worked at the hospital down in Our Lady of the Lake in Baton Rouge, watching my time, and it was, they were told, I said, well, I'm not working in the ER. I'm not going to the ER where I work, because they know me. I'm so great. And so they said, well, you can go to Vermilion, where Dr. Bob Winston was. And so I debated with him my my diagnosis. He said he's out. Watching him write it, it says alcohol dependent. I said, no, sir, that's alcohol abuse. See, I know the criteria based on the DSM-4, which was what at the time, and I'm only drinking maybe every other weekend, so I have a sort of a sense of control. So it's not dependent in nature that I must have it in order to survey withdrawals and whatnot. So it's abuse. And he said, how many times have you been to treatment? I was like, well, maybe 2 or 3 times. But he said, well, what side of the desk are you on today, Greg? And I was like, I'm on this side. And he goes, well, I'm going to go ahead and recommend that you go to a residential level of treatment, or you can talk about to your board about this. And so at that point in time, I was like, oh, okay. So the intellectualization of justifying and rationalizing and trying to wordsmith, as any attorneys out there.
Yeah.
I'm trying to wordsmith my way through. And again, it's a defense mechanism. And how many masks do I have? Because the whole point of it is that here's how many masks. You think I'm these people. And so how you come across and try to engage these people, and you're so convinced that they're this person that you keep trying to prod and pry this kind of information out. And it's the wrong person. So our approach may be incorrect. And how we engage. So I ask people to flip the script. How many masks do you have on? So we're all sitting in this room, and we may be preoccupied with some thoughts at home, or I don't know, maybe our bills due, or other issues outside. So I'm not really present with you right now. I'm giving you a smiley face, and we're talking, and yada yada yada, but I'm not really here. And so I'm giving you the false face of attention, or just whatever. I got my work face on, I got my home face on, and so I'm not really practicing all these principles in all my affairs. And so the whole purpose of this presentation I give is to find out, who am I? Where have I been?
To find your voice.
Amen.
Yeah.
And so therefore that's the whole rest. That's the premise of I want you to take a look at where you've been. And then the beauty of this whole thing is you get to recreate or co-create who you want to be. You can be anybody you want to be. Well, within reality.
Within reason.
Yeah.
Yeah. And so
But we have to see that. We have to see it.
yes.
Yeah.
So that's, I guess that would be the premise if you wanted to put the platform of what it is I exactly do to try to pull, and to help, what can you get out of group? Because it's so terrifying. It is so terrifying. Well, I was in treatment for 5 months, and it was a 90-day program. So I did the math. It was 157 days, and it's like I'm watching people come and go, and I'm still there, and they're like, "You just don't get it." I said, "I guess not," and I did. I went back drinking 3 years later. There's such a fog that some alcoholics, like persons like myself, who use whatever substances they did on such a regular basis, that the brain is saturated, and if not, hopefully no Korsakoff syndrome. But it takes time, a few years, to be able to get back on track, and engage. And those relationships are what make the change. I think the power of group is a godsend. We're born in a group.
It jump starts those relationships for us, doesn't it?
Well, it does. We were born in a group, our family system, and we cultivate into that. And then when we're unhealthy, we're pathologically in that group. And it would only make sense. The only way I'm going to get help is in a group. And so the solution is being able to get the temporal lobes and the prefrontal cortex all back online with different behaviors based on the relationships that we have, that we formulate. I'll say, based on what you just said with the power group earlier. I mean, wow, when you start really, and you feel, wow, that's profound. And when you start experiencing those profound moments, it's like, wow, I never knew I could experience that. And
When you have a group member that says, I don't know why I just said all that, I wasn't going to talk today. And they just go on for 15 minutes and talk about their feelings and their past, and that it's those kind of moments that you go, wow, and that's the power of the group. That's not the power of the counselor.
Amen. That's right.
Yeah. And that's something that I wish we could bottle and show, or have people experience, as we're trying to coax them towards a group process like AA.
Well, I have a group member the other day that said, I wish everyone I knew could get to come to group like this.
Yeah.
Isn't that a joy?
That's such a compliment. I mean, it's a compliment to everything that we're trying to accomplish in our center. So and it was I thought it was a compliment to the group because it was everyone that was engaging and everyone was being vulnerable and it was just when you get that kind of that feeling, you can't, it's indescribable.
We are with Gregory Greer, and he's a walking group in his own mind, a legend in his own mind.
Indeed.
Voicesofrecovery.org. We'll be back.
Going back in the alley. And I kept rolling them seven and winning all them parts. My luck was so good I could do no wrong. I just kept on rolling and controlling them bones. Finally they just threw up their hand and said, when you hot, you hot. Baby, do you understand me now? Sometimes I feel
I'm trying, man. I'm trying. Welcome back. 1017 FM and 710 KEEL. Welcome back into Strategies for Living. PLPC Carla McCormick, marriage and family therapist David McMillan, social worker Gregory Greer, the Voices of Recovery LLC. You can find him at voicesofrecovery.org. You absolutely love this stuff.
I do.
It comes through. Comes through loud and clear.
Oh, you're saying you can tell that I absolutely love this stuff. Is that what you're saying?
Yeah.
Oh,
You
okay.
love this stuff. You love what you do.
I do.
You're passionate.
What's the word? It livens. It gives me energy.
Yeah.
So when you connect, you're alert. It's coherent. It's cohesive.
Yeah. You, I know you've got some exciting things coming up. In the future, we can look towards actually seeing some of this. I know you're gonna be working here with some filming coming up, aren't you?
Well, I'm hoping so.
Yeah. Keep your fingers crossed.
I am. That's it.
Yeah.
We'll see what happens.
But you're available to groups. Could be AA groups. Could be church groups. All they do is go to voicesofrecovery.org, and you got contact information there. I
do. Well, voicesofrecovery.org. Phone number is area code 318-366-2553. The website, I think, spells it out really well as far as what events, what I can work with. It's not just treatment centers,
right?
But it is groups. I have gone to schools. I have spoken at the college, the university levels, and those are actually great because kids are in that environment. I don't know if you guys, college. I went to school late. I mean, I started the first time, but to really engage the population, and actually they're far more interested than you think.
Oh yeah.
A lot of people think, oh, they wouldn't because they want to go party, but you would be surprised. There are a lot of open-minded college souls out there.
And they may be partying like crazy, but there's another part of them.
There is. Well, so many people go through a phase. There's such a large demographic that isn't just a phase. Right. And then there's people like me that just, it was like, well, we'll get there. But
I hope people like you will come back here now that you know how to find your way to the studio. I hope you won't be a stranger.
I would love to come back. Thank you. That's an invitation. I take
that
it.
is
definitely an invitation, and I want you to come back often, Greg.
I'm more than happy to. Thank you for having me.
In the meantime, folks, Greg Greer, and you can find him at voicesofrecovery.org. Carla, you've done it again. What do you think of my friend Bill and Tony and?
I like Greg the best.
Yeah, I do too.
Thank you, Jesus. There is a God.
Yes, there is. Yes, there. Amen. Hallelujah. Reuben Wright, you've done it again. Carla McCormick, you've done it again. Greg, you've really done it again. Folks, thank you for listening. We brought to you by CADA, by Jerry Anderson State Farm, by Learning RX, by Highland Place Rehab and Nursing Center, by Jacob's Well Inspirational Books and Gifts, and by Resilient House. If today were the last day of your life, you only had one more phone call that you could make, who is it that you would call? And what is it that you'd say? And why are you waiting? Make the call. For Greg Greer and for Carla McCormick, I'm David McMillan. See you next time here on Strategies for Living.
Trending talk. This is 101.7 FM and 710 KEEL. KEEL. Shreveport.
New tariffs. I'm Lisa Lacera, Fox News. President Trump now taking aim at Turkey.
Amid a growing diplomatic dispute between the U.S. and Turkey, President Trump tweeting, I have just authorized a doubling of tariffs on steel and aluminum with respect to Turkey as their currency, the Turkish lira, slides rapidly downward against our very strong dollar. He continued, aluminum will now be